Hi everyone, my name is Stephanie Van Witzenberg, and today I'm going to take you on a deep dive into two potential career interests that I've been deciding between. The first one is occupational therapist, and the second one is special education teacher. The purpose of my research is to gather logistics and try to decide if I should further my career in occupational therapy or embark on a new journey into special education. So we're going to start with occupational therapists first. The primary role of an occupational therapist is to evaluate and treat people who have injuries, illnesses, and disabilities to just promote that overall independence with daily living skills and vocational skills, and just to allow for meaningful participation in everyday life. In order to become an occupational therapist, you must obtain a master's degree or doctorate degree in occupational therapy at an accredited program. Most programs are 2 to 3 years. And after completing that master's degree, you must pass a board exam and get a state license. The expected growth rate right now for this field is 11% from 2023 to 2033, which makes sense because our population in the United States is aging, and older adults and that geriatric population is going to need more assistance as time goes on. Some additional information about the field: the median salary right now for an OT with a master's degree is $96,370. There is a lot of variety when it comes to the environment you can work in this field. You can work anywhere from a hospital to a school, in rehabs, nursing homes, mental health facilities. And what I find interesting is that you can even participate in clinical research. Some drawbacks to this field includes risk for injury, high caseloads, and risk for illness. Some advantages is there is so much variety, especially with the settings that you can work in, and the opportunity for growth, not only within the field, but also individual growth as well. So you can become a director of rehab, a lead occupational therapist, or become a supervisor for certified occupational therapy assistants. Okay, so now we're going to dive into special education teachers. The primary role of a special ed teacher is to adapt lessons to teach various subjects with students who have mild to severe disabilities. So this can range from just global developmental delay to as severe as cerebral palsies, where they are quadriplegics and don't have a lot of movement within their bodies. You need a bachelor's degree. You need to pass a background check, complete a student teaching rotation, and obtain a general teaching certificate from a test that you take. Something that surprised me was the projected growth rate for this career. According to the U.S. Bureau of Labor and Statistics, there is very little to none projected growth rate for this career. And this surprises me because my district right now that I work in the school system has a need for about 6 or 7 special education teachers. So I found that surprising. So we're going to move on to additional information. Right now, the median pay for a special education teacher is $65,910. You can work at a public school, private school, or a therapeutic program. And it's important to keep in mind that private schools don't always have special education teachers because they are privately funded. Some drawbacks that you can get from this job is stress, and it could be emotionally demanding. There's minimal room for growth, and it could be physically draining as well. Some advantages are you get summers off and breaks, which could counteract some of those drawbacks. Now, if we're going to compare the two fields, they both have some similarities and differences. They both encompass the practice of teaching and helping, and they both put you at risk for burnout. Some differences is the pay. OTs make a bit more. In special education, you are limited to the setting you can work on and in, and the education you need in OT requires a master's degree, where special education teacher requires a bachelor's degree, and just that overall job growth we discussed earlier. Now, after doing some further research into these fields, I think that OT is for me. For me, it encompasses a lot of my skills, interests, and career goals. I have a passion for helping people, and I would also like to be my own boss one day. And I feel like there's a lot of flexibility and variety that OT has to offer. And I think this career can lead me down that path. So thank you for listening. And here are some citations. All right. Thank you, everyone.